When you have a child with complex medical condition like cerebral palsy, sometimes there are big decisions to be made. The model of care that we provide enhance decision making and with enhanced trust and communication among the team, some of those things become little bit easier.
Cerebral palsy is a disorder of movement and posture caused by non-progressive abnormality of the immature brain that originates during the prenatal or perinatal period or first few years of life. Diagnosis is mainly based on recognition of significant delays in motor development.
We need to look for signs of physical abuse during examination, note the findings in a chart and report any suspected abuse to Child Protective Services, as abuse is more common in children with developmental disabilities.
Be sensitive to communication methods the child uses, including gestures and verbal, non-verbal requests. The degree of intellectual disability varies with each child. Some child may have normal cognition while others may have severe deficit. Explain each procedure at a level that the child understands. Patient in wheelchair can also be treated on the chair by supporting their head and neck as done on the dental chair. Common oral manifestation includes increased risk for dental caries and periodontal disease, enamel hypoplasia, tongue thrust, mouth bleeding, hyperactive or hypoactive gag reflex, siluria. Use tell-show-do approach when introducing new instruments or procedures as appropriate by child. Consult with caregiver if unable to understand patient's speech. Minimize light, sounds and sudden movements that trigger primitive reflexes or uncontrolled movements. Explain each procedure at a level that the child understands. Use short, clear instructions. Give only one direction at a time. Place dental instruments slowly into the mouth and place child's chin in a downward position to mitigate hyperactive gag reflex. Consider using a mouth probe with dental floss attached. Hence, tell-show-do plays a very important role.
Seizure is quite common among CP patients. It is seen in almost 30 to 50% of the patient. So in case an episode occurs in a dental clinic, we have to be aware and know how to manage them.
Caregivers may benefit from guidance regarding oral home care. Brushing in a supine position with a mouth probe may be indicated. Child's comfort and happiness is of utmost importance. Lastly, cerebral palsy patients are not disabled. They are differently abled. Thank you.